Thank you very much, Mrs. Aaron, and also Permanent Secretary Mr. Leighton in the Ministry of Health and the Environment. I know that both of you mentioned a statement. A statement is something that is well prepared. I would rather have said that to speak to the person, of course, to all the many listeners, of course, across Dominica, across the region, and further afield. This is my very first official press briefing since Maria as a Minister of Health. So as one can imagine, I might have quite a bit to say, although I will leave the finer points to the more apt technical staff, the technocrats here with us. But let me just say, first and foremost, thanks to the organizers of this press briefing for having the Ministry of Health this morning, and of course for allowing me to speak. Let me just say good morning to everyone present here. And again, as I said, and Mrs. Aaron mentioned, importantly, the residents of the PD7 constituency, and of course the wider Dominican public, our regional counterparts, and I'm sure all of those listening watching via YouTube, the Prime Minister's Facebook page, among many, many, many other media. Let me begin, of course, first by offering my own personal condolences and on behalf of the those of the Ministry of Health to all those, of course, who suffered loss, death, of course, missing, presumed dead, and of course, those who lost property, material loss, which would be all of us in here, I presume, due to the passage of Hurricane Maria. It's been, I think, 1 day to 2 months that we had that Dominica experienced the passage of Hurricane Maria, which really was something I think that none of us prepared for. I like to refer to it as a Category 10 storm, because I think they stopped, from what I've been told, they stopped at the Category 5, but if you look at the increments from 1 to 5, I think based on what the experts told us, with gusts of 200 or 220 miles per hour wind, I would like to think this would have taken us into the Category 10 or maybe 12 zone. So I really would like to express my condolences to all those I said who suffered loss during Maria. And before I go into the gist of my presentation, I really would like to join the Permanent Secretary in expressing my own sincere thanks to the staff of the Ministry of Health. And I will begin with the Permanent Secretary and the administrative staff, the Permanent Secretary, the CMO, PNO, who says I like to forget her sometimes, the Hospital Medical Director, my Director of Primary Healthcare, in fact, all the other heads of department, who I think whose dedication and whose work was exemplary in the aftermath of Hurricane Maria. This being said, equally as exemplary would be the work of the medical teams in the various districts at the Princess Margaret Hospital. The commitment and dedication shown by this staff, was exemplary. And I can tell you, I being frozen on the ground in Grand Bay, not being able to move from Grand Bay, and basically lived at the health center for the first 7 days or so after the storm. And again, I would like to add that if we could carry some of this dedication, that's a percentage, 10% of this dedication and commitment that was shown post-Maria going forward, I think we in Dominica could have a health system that the whole world could be proud of. Again, yes, these were extraordinary circumstances, and I like to say that extraordinary situation that called for extraordinary efforts by extraordinary people. And I think the staff of the Ministry of Health proved just that they're really extraordinary. So starting from the Permanent Secretary all the way down to the janitors at the various health centers, I really would like to thank you, sincerely thank you for the work that you have done, you did, and continue to do in the aftermath of Hurricane Maria. As it pertains to, of course, the regional and international cooperation, I too would also like to express my thanks to all. And again, as the Permanent Secretary said earlier, during the course of this event, of this activity, I'm sure you would get a comprehensive list, an exhaustive list of all the organizations who would have rushed to our shores. Some of them even probably the day after Maria, probably the night in some cases, and continue to come in to offer the assistance to the Ministry of Health and, of course, the Commonwealth of Dominica by extension. And time and space will really not permit me to mention all of them, but there are a few that I think we need to mention, like PAHO, who has continued to be a great partner to the Ministry of Health, and in fact to all the member countries of the organization. But here in Dominica, we can attest to the fact that PAHO has always been there for us. We can speak to Israel, our Cuban friends, our Venezuelan counterparts, our CARICOM brothers and sisters who would have sent both doctors and nurses and Hands International. We can speak to Electricians Without Borders, Electriciens Sans Frontières, I think it's said in French. If you could, if I may be allowed to try my tongue at French. So all of these organizations, I said, who would have rushed to our shores, we really want to thank them. And even as we speak, we have organization groups and people who continue to come in person, others through various media, telephone, email, would have expressed the interest in continuing to assist Dominica. Because whilst we're out of the woods per se in terms of the immediate post-disaster period, we still need a lot of assistance. We have a health system to rebuild, and of course a much more resilient one. Because you would have heard the statement of the Honorable Prime Minister as it pertains to building a climate-resilient country. And the climate-resilient country does not only speak to the infrastructure, it speaks to all sectors, being the climate-resilient health sector also. Of course, we would have started this journey even prior to Maria. Those of us and all of us in here, I'm sure, familiar with the SMART project, a Smart Health Facility project funded by DFID and being implemented by PAHO. And as we speak, the project would have already started in La Plaine because we would have identified 3 health facilities for smarting, quote-unquote smarting. In fact, that turned out to be one out, worked out a little against us because the temporary building where the Type 3 Health Center was being housed during Maria, well, prior to Maria rather, would have suffered extensive damage while the project would have started on the actual Type 3 Health Center, or the permanent structure rather. But since then, thanks to wonderful staff like my director, the PS, etc., the temporary building or the building that's being leased in the interim has been repaired and work continues on the Type 3 Health Center in La Plaine and smarting. Now, what is smarting? And of course, in light of Hurricane Maria, the issue of the smart health centers comes into sharp focus and are even more relevant. Why? Because the smart, I'm not sure if it's the same smart that the IT people use, but what this means is that to make these facilities much more resilient and to make them continue to serve people, especially in the post-disaster, because this is when, unfortunately, that the services would be needed the most after disaster. So we would have had a few examples, for example, of generator failures and even extensive damage to buildings in various communities post-Maria, and we all know what that would have resulted in. People who will be sick, people need their maintenance drugs, people need to visit the doctor, etc. And if they cannot do that in the post-disaster period, then we know that the effect of that could be even worse than the actual disaster itself. And in fact, to tend to the injuries and the traumas, etc., experienced during the actual disaster. So we need to ensure that our facilities, especially the Type 3 facilities, in fact, all our facilities should be up and running even during the disaster and immediately thereafter. So this smarting would include, of course, the issue of having a supply of potable water, even when our normal water system would fail. The issue of energy. So while all of the Type 3 health centers would have been outfitted with generators, some of these generators would have also suffered damage because the housing would have damage, etc. And in the case of Grand Bay, we had a failure for a day or two because of flooding, etc. So we need to look at renewable energies. In other words, what happens on the outside should not affect the health center. The health center should be, of course, you will expect maybe the little window broken and stuff like that, but the health center should continue to function with a proper source of energy, potable water, etc., so health services can continue. So we are continuing full steam with our smart health facility project. I think I mentioned earlier we would have identified 3 health facilities in the first instance: Grand Bay, La Plaine, and Roseau, if I recall. But we would have had a few others carried in for the shorter term, Marigot, Portsmouth. So what we've done since Maria, we would have spoken to, of course, our benefactors, the donors and DFID, to ask them whether they couldn't fast track, the funding for these other facilities, and so far there are positive signs that this will be done. So the health sector, like all other sectors in Dominica, we did suffer damage, infrastructural damage, among others. And of course, even I think more profound would be the fact that the staff would now be required to provide services to the people, injured people who are sick, people who require in the maintenance, the continued management, health management. They themselves would have left their homes. Some of them have their roofs uncovered, and now have to put all of this behind them to treat people, which is why I think that post Maria, the example showed by the staff, by our staff, was really needs. I mean, it really cannot be underscored enough that they had to put all of this behind them to continue. Some of them I know days away from their home, days, 3-4 days at the health facilities, and knowing that their roof would have gone, the flooding, etc. But they had to put all of this behind them to continue serving people. So, which is why I really need to underscore our sincere thanks at the Ministry of Health. In terms of infrastructural damage, I don't want to spend too much time on that. I think we should focus on recovery, which 2 months since Maria. But we know PMH did suffer extensive damage, PMH that is. As we speak, repair works are in full swing, although I have told the PS that we need to light some fire under the parties concerned, because I think 2 months after Maria, I think by now that the entire PMH should be covered. We are hoping that in the coming weeks, in the coming week, we should be signing contracts with multiple contractors, because there's no reason why we should be having one contractor doing one part of our main and only hospital, moving on to the next. So why can't we have 5-6 contractors each engaged in a particular part of the hospital? So the PS is on board with me in this regard. So we are going full steam ahead next week. Unfortunately, some of the with the ongoing works of the new national hospital, some of the temporary buildings like the lab, etc., would have been flattened, but I've been advised that since then our laboratory services and etc. would be up and running. As it pertains to the health centers at the rural or the community levels, I'm pleased to announce that all our 7 Type 3 health centers are up and running. As I said, the only difficulty we would have had would have been with Lapland, because it was being housed in a residential building while work was being done to smart the original Type 3 health centers. But since then, all work had been done, and Lapland services continue Type 3 health center. Unfortunately, not all of our Type 2, that is the smaller ones in the smaller communities, would have been so lucky. I can speak to Pishland, my own constituency, where it was obliterated is a word, where there's no evidence that even a building existed there. Slide took it, and then the river did the rest. Not all of the damage in the other facilities was dramatic, but we would have suffered various degrees of damage to the other Type 2 health centers, which we are working fervently to. Type 1 health center, which are working fervently, of course. In areas where the health center is not usable, we would have engaged in listing private homes available at least, and I'm sure you could appreciate the difficulty in getting an available home, but the Ministry of Health staff, under the astute direction of leadership of our young director, up-and-coming director, would have made it possible where they could get buildings to be leased and services continue. In terms of electricity, all our Type 1 health centers have been powered, thanks to Electricians Without Borders, Electriciens Sans Frontières, practicing my French again, Sans Frontières, would have provided generators to all of the Type 1 health facilities. All except 5 are functional now, and of course these 5 would be these that have been extensively damaged, and of course going forward we have to come up with a strategy as to whether these health facilities are worth repairing, or we consider demolition and building a new facility. Of course I need a new facility in Pishne, PS. Okay. The new national hospital, I'm sure lots of questions around it, I'm sure, but just to put your mind at rest and the population, that the new national hospital will continue. In fact, may I dare say now more than ever, because this new national hospital is being built, of course, with existing standards, not existing, what's the word I want to use, standards that would withstand these natural disasters. So now more than ever, we need to continue with the new national hospital. Of course, as we discussed in the ministry, the scope might have to be reviewed a bit. So while we know it was being built to withstand hurricanes, we now know that the Category 10 hurricane exists. Don't quote me on this, it's just me, but the Category 10 is just my own coding of it. And we have to clearly, of course, review the scope of work of the new national hospital, and not just the new national hospital, any facility that we will be building from now on. And by those of us, again, familiar with the budget would know that on the cards we had new facilities to be built in Viecas, Newtown, Bellevue, Chopin, again, my constituency, Corleho. So, of course, as I said, these are being reviewed. Obviously, the scope of works have to be reviewed, especially in keeping with the government and Prime Minister's announcement as it pertains to building a climate-resilient country, the world's first climate resilient country. Marigot, we have to continue. The Marigot Hospital is still on the cards, and in fact, just yesterday would have gotten the good news from the government of Mexico that the final signature has been put to the funding for the new Marigot Hospital. We knew that a commitment was made, money was approved. So at the Ministry of Health, what we're doing, we are finalizing the tender documents towards the demolition of the old Marigot building, so the site can be cleared, and then construction begin on the Marigot Hospital as soon as possible. Again, as I said, no more than ever, we have to ensure, of course, we've reviewed scope of works to ensure that the Marigot Hospital is built, given its strategic location in the Northeast, airport or main airport, etc. As it pertains to the Marigot Health Center, this is still being discussed at the ministry level, because there has been this different school of thought as to whether it should be in the vicinity of the new hospital or whether we identify another site. So this, of course, has to be finalized. But we are going full speed ahead with the new Marigot Hospital. Again, I said no more than ever. Again, as I would have mentioned earlier, prior to Maria, we would have engaged the services of UNOPS, United Nations Office for Project Services, I think, something of that sort, towards the designs, and of course supervision of works for that particular project. So we are engaging just the very best for this particular project. Post Maria, of course, we would have had a number of issues, as we know, with our medical supplies, pharmaceuticals, CMS, Central Medical Stores, of course, suffered extensive damage, the roof. So we would have had loss of stock. I'm sure the PS or the CMO, one of the others, will give the actual percentage of loss of stock. But we want to really thank our partners, regional, international, and even individuals who would have come forward with donations as it pertains to, first of all, emergency stock, post-Maria, and of course in the longer run replacing some of our maintenance drugs for hypertensive, etc. So I really want to thank all of these. Again, too numerous to mention. Just want to say a big thank you to all who would have come forward and donated. We spoke about the type 3 health centers already. Repairs to PMH, I mentioned, is ongoing. We would have already done Alford Ward, albeit temporarily. We still might have some other works to do. The ICU, they have moved on to Durbini Ward. So as we speak, I think maybe just 3 or 4 more sections of the PMH to do. I think the old APU and a couple of the sections at the PMH to be done. And again, as I said, I've already discussed with the peer that we need to move with this full steam ahead. Going forward, the plans of the ministry, all our plans, if you would have realized during my presentation, all our plans, we are going full steam ahead with all our plans. Of course, as I said, there will be some review as it pertains to infrastructural work, review of the scope of works. The new health insurance continues, and I think no more than ever, the issue of regional, of even expanding this to a regional health insurance program is brought to the fore, and I'll tell you why. Because we saw the need for the evacuation of a number of our citizens post-Maria with damage to the hospital, of course, them injured, and again, days after, or the medical cases that were too complicated to be handled here, especially in light of the damage to the Princess Margaret Hospital. And the issue of regional insurance has been on the cards, on the topic ever since I became a minister 8 years ago. It's been that long. 8 years ago, that to facilitate the movement of our people seeking medical service within the sub-region and even the wider CARICOM region. And in fact, just coming, Permanent Secretary Later and myself would tell you that just coming from a meeting in Martinique, OECS Council of Ministers meeting, the 4th hosted in Martinique, and of course Martinique now being an official member of the OECS, the issue of this regional insurance came into sharp focus. So while there's this ad hoc arrangement between Dominica and a number of the other OECS countries and Martinique for medevacing patients and even outpatients seeking medical assistance, we think the time has come for us to formalize this arrangement. Martinique, of course, being a country very advanced in terms of its medical health sector, radiology, laboratory services, among others. We think the time has come now for us to formalize, even between country and Martinique, or even at the OECS level. So the OECS Commission had been mandated to pen a draft memorandum of understanding to member countries to be sent, of course, for review by the individual respective countries, rather, for eventual signing after cabinet and, of course, endorsement. So Legislation, we want in the very near future to take to Parliament a medical act. In fact, we've been asked by the Attorney General office to put the two or three legislation that we want to be given urgent attention: the Medical Act and other associated acts like the Nursing Act and Associated Medical Services Act. And even more importantly to me, and even dearer to my heart, would be this new environmental legislation. And I know I sound like a stock record because this is legislation we've been working on since I took on the portfolio of Minister of Environment 8 years ago. This legislation has been drafted, and we're hoping that sometime in the near future that we can take this legislation to Parliament. And I'll tell you why. Especially in view of what happened post-Maria, and especially in light of the Prime Minister and government's statement as to making Dominica the first climate resilient country in the world. This legislation is going to be super, ultra important because this legislation deals with establishing in-house offices, in-house agencies that are going to deal with the issues of climate change. Because while we hear of billions of dollars out there for climate change, some of this money will not come down to us unless we have our in-house, unless we do everything at home and everything set up. So this legislation, I think, is going to be play a pivotal role into manifesting or realizing this vision of making Dominica the first climate resilient country in the world to leverage this much needed funding. Solid waste, the manager is here, and I'm sure he'll speak to it. But just quickly, again, all of us in here are press people or in the hierarchy of the Ministry of Health, and we would know that we would have seen an increase in the subvention to solid waste in this year's budget, and also money is put aside for the procurement of 2 new compact trucks. Unfortunately, the procurement of the trucks didn't come through before Maria, which would have really helped us had it come through before. But of course, we're hoping that we can continue the process. I think they've already been sourced, and it's just a matter of making the payments, etc. Going forward, the plan is that we would of course, purchase a few more of these compact trucks to deal with the urban waste collection, and in the rural communities, or what I call the rural communities, that we could outsource this service. So this, of course, is being discussed to facilitate, and I really want to thank Mr. Mitchell, the General Manager of Solid Waste, for really making things happen under very difficult circumstances. We know that the corporation has been under serious difficulties, and we really want to thank you for making things happen, Mr. Mitchell, you and your staff. So medium to long term, of course, we're looking at the upgrade of the landfill, and of course the issue of purchasing and implementing new technology, recycling, etc. We would have been in talk with a number of interested business ever since, again, 7 years ago. Interested in doing business as it pertains to solid waste management. Okay, so we're looking at about 3 or 4 promising proposals, of course, and in the coming weeks or so we would roll out if these proposals are accepted by us. We want to also thank PAHO for an incinerator at the hospital to deal with our biomedical waste, and then the plan is that another one be purchased for the district to deal with the biomedical waste, because really and truly, as exists now, it's really not the ideal way to deal with biomedical waste, what is happening right now. So we want to thank PAHO for this. What else can I say? But I think it's opportune that I speak briefly to the situation ongoing at Kubuli, because I'm sure the press maybe I see Mr. Morris here spoke up. I'm sure he's on top of it and will probably ask questions. So I'm one of the people who like to say things, so then I don't give you a chance to ask any questions after. The situation at the Kubuli factory. We know that Kubuli, like many other buildings, suffered extensive damage during the passage of Hurricane Maria. I keep on saying Erica, of course, because Erica would have been on my tongue, on my mind a lot. Hurricane Maria. Now, couple weeks after Hurricane Maria, we were informed, questionable ways, but informed nonetheless, as to the presence of ammonia at the old Kubuli factory. I think the damage would be the river would have passed through the plant, plus a few slides, etc. But we were ensured that the ammonia at the factory would be safe in contained tanks. Of course, the DBBL, Dominica Beverage and Brewery Limited, I think I have that correct, would have assured us that they would be doing periodical checks, monitoring the presence of ammonia in the immediate area. Up to about a week ago, there was no measured ammonia in the area. But about a week ago, they noticed that there was this ammonia, this small leakage, which unfortunately has been increasing on a daily basis. So here we were caught between the devil and the dark blue sea, and something had to be done. So they would have engaged, that is the DBBL, would have engaged a highly specialized team from mainland USA and Puerto Rico to come up with a plan to get rid of this ammonia, because this ammonia cannot remain there, because God forbid, and I think to make matters worse, the site of the leak hasn't been identified. So they're saying that while they assured us that the leak is not coming from the contained system and it could be residual in their piping system, because I think the ammonia is being used for refrigerants, etc., for the cooling system, they still haven't been able to physically or visibly identify that particular leak. So what do they have to do? We had to get rid of the ammonia that is contained within that vat or whatever container it is. So it's an internationally accepted process, what they call of degradation, where this ammonia is now going to be passed through water and neutralize it. So this is what is happening at Kubuli as we speak. Of course, to allow that to happen, a number of stakeholders and other government departments would have had to get involved. The police, the fire service, the health ministry, among others. And on this note, I'm sure a number of the residents in the area will be listening to this press conference. I really want to thank the residents of this area, especially those in the vicinity of the plant, who would have really cooperated very well if was even the notice was a bit late to agree to move out, because there were 3 or 5 houses, PS, 3 homes, I think, in the immediate in the vicinity of the plant, that it was recommended that they be evacuated during the course of this 12-hour course of the procedure. But just to reassure Dominicans that all is in place to ensure the safety of the citizens. And as I said before, the process which is being engaged, they've been done by a highly specialized team, and is an internationally approved process, which is the degradation of ammonia. So the road would have been closed from 9 o'clock this morning to 9 tonight, of course, with intermittent allowance of vehicles along the road. So we're hoping and, of course, praying that all goes well. Of course, there's certain risk involved, especially when they're going to tap into the vat containing the ammonia, might have a little escape of ammonia. But this is being monitored constantly. And of course, the public will then be notified of any mishap. And I'm pretty sure, I'm an eternal optimist that there's going to be no mishap. That's correct, right? Okay. So I think I covered all what was on my mind and my heart. Just to say one more time that I really would like to thank the health, each and every one of you. Within the various departments, head of departments, and your staff. I'm sure in the near future that I will be reminded as a minister that I had high praise for them, and now is the time to show it. Yes. Okay, especially when negotiations come around, salary negotiations. But I really want to say that there are rewards that are far greater than monetary figures. But the work that they did, honestly, was exemplary. And as a Minister of Health, I really want to say that I will forever remember the effort by each and every one of you. And again, the Permanent Secretary and the other heads of department for holding the fort. I remember when the PAHO director came, she said that they're going to have to get a residence in Roseau, because every time there's a disaster in my area, I forget I'm the Minister of Health. But we need to understand also that I live in Granby. Granby was cut off for a week or so, and I want to really thank the PS and the other heads for holding the fort in my absence in the immediate days. Just a quick update, especially as I spoke about Martinique and how they've been very helpful to us. The Honorable Parliamentary Representative for the Grand Fond constituency, I think Monjon River-Syric, I think it's called Monjon River-Syric constituency, and also the Parliamentary Secretary within the Ministry of Health. I like to refer to him as my level-headed deputy. I tell people he is a calm voice, while sometimes I can be a little out of control, for want of a better term. But we know that he would have been in Martinique for the better part of probably 4 months prior to Maria. We know that he would have suffered a massive stroke. But I really want to reassure the nation that the recovery that Honorable Stevenson has made is really remarkable. Even the doctors in Martinique, of many years' experience, okay? They've been amazed at the recovery that he has made, such that he is due back on island this morning, which is why sometime during the course of the next few minutes, I will have to leave this really wonderful ceremony to go receive him, of course, as his colleague and the Minister of Health. So he is due to to disembark sometime during the course of today to continue, of course, his medical management here, mainly physiotherapy, among others. So I think this is wonderful news for myself as his colleague. We entered politics together, he and I. Both of us came from the medical profession, he being an environmental health officer, and I'm sure for his family, and also the residents of the Monjon River Syriac constituency. So, yeah. So thank you very much. Yeah.